Looks like we're pretty much right at 10 o'clock, you guys. So I think we'll go ahead and open it up and get started. And if anyone else joins us, that's fine. Otherwise, we're being recorded. So this will be available to anybody to watch at any time. So with that, I just say good morning to everyone who's watching us this morning, and good morning to any of those who will watch this via the recorded message at your convenience later. So glad you're joining us. We are here with a couple of our friends from Columbus Springs Hospital. Katie Rader is going to lead this presentation for us this morning. Good morning, Katie. How are you?
Good morning. Doing well.
Good. We were just chatting about some of the downside to being sheltered inside and maybe not making the best nutritional choices for the last 3.5 months, but we'll move past that for sure.
Right.
Anyway, our Zoom series has been such a nice add-on for the Chamber and a great way for our members to share some of the things that they have special knowledge about and encourage and build up our community with that knowledge. And so we have had all kinds of different Zoominars over the last several months, and we certainly have more coming up, and we're scheduling more. So we're going to have the Better Business Bureau with us here in a couple of weeks. We're going to have a super awesome marketing team coming together to do kind of a panel discussion and some other stuff. So by all means, keep an eye on, for the members, Chamber members, keep an eye on your email, and you'll be getting notified of the dates and times of those so you can register. And again, if you can't watch it when we do the actual presentation, then those are always available at our website, gcchamber.org, and on some of our social media pages as well, including, of course, our YouTube page. So with all that being said, just want to welcome Katie this morning. She's going to tell us how to keep our mental health in good condition as we're going through that. And I think we could probably all use some good guidance on that. So welcome, Katie.
Yes, thank you. That was a great introduction. Yeah, so I'm going to go through, today I'm going to talk about what exactly I mean by, employee well-being and how that pertains to the workplace, kind of the prevalence in the workplace, how to kind of translate that into a helpful resource and giving them, empowering them to reach out, to feel comfortable to reach out, to feel comfortable to seek resources, going over some warning signs, some things that should kind of stand out to you and be kind of an alarm bell or red flag that this person might need some help. And then I'm going to discuss the resources we have at Columbus Springs. We've developed some new stuff because of our new ever-changing world. So I'll talk about that. And then I want to also say that I'm happy to meet with any chamber members or other business members that would like to have a presentation specifically tailored to, some themes that they're seeing within their office, or we just can make it very specific around what exactly you want and kind of give everybody the tools, because a lot of, upper and middle management states that they don't have the resources when employees do have mental health concerns. So I'll go ahead and get this PowerPoint started here. So yeah, we're going to demonstrate that your company considers employee well-being essential. We're talking a lot about our physical health right now, and that kind of all ties into each other. And I'm going to kind of demonstrate what there's a wellness wheel that really exemplifies that. So why this is important right now is because I really like this quote off to the left that talks about this is a really defining moment, and that people are going to look back and see, reflect on how they were treated by their employers, how they were kind of taken care of, what employers went out of their way to help and what employers, didn't. So this is really a time to look at how we're treating our employees, because we know that we're seeing skyrocketing anxiety and depression and substance abuse, especially alcohol sales are extremely high. We've seen a lot of alcohol detox. So, even though somebody may be functioning perfectly well at work, they could still be, drinking, to the point of passing out every evening, and they definitely need some support there. So like I said, we can provide a tailored presentation to kind of meet with you and discuss what exactly your industry's needs are, and what exactly you'd like me to kind of delve into. And here's another statistic that 35% of managers feel they have no formal support or resources to help their employees. So this is really a great opportunity to put those resources in their hands, so that, hopefully this isn't something that you're running into day to day or week to week, but it is going to come across. You are going to have those people that are struggling, and to establish yourself as someone who prioritizes mental health and wants your employees to come forth, wants them to get help rather than to just lose their jobs or have poor performance for years on end. It's just this is a really great way to get those resources in those managers' hands. So this is the wellness wheel I was talking about. When we're talking about well-being, it has a lot of different components to it. Even when we talk to mental well-being, these are kind of all encompassed in the overall view of mental well-being. I got this wellness wheel from the Yale School of Medicine. I thought it just really demonstrated exactly what all we were talking about when we talk about mental wellness. So I won't go over each and every one, but some ones to point out are, your emotional wellness. So that has to do with your stress. We produce cortisol, the stress hormone that's running through our bodies when we're out of practice, out of routine, and we all are thrown out of routine right now. So keeping in mind how we kind of get those stress hormones out of our bodies, which you can do with exercise and different mindfulness practices and things. But it's just some things to consider that we don't necessarily think about in the workplace, but we're all experiencing it all the time. So obviously it's going to affect our workplace. Just like when one of these pieces of the wheel is out of balance, it's going to make your wheel run funny, be a little wobbly. So keeping these all in balance and having an idea that, even our environment has an impact on, our space, our workplace, making sure that we have open space and lots of natural light, maybe some plants and greenery and things that makes an impact on our mental wellness. So just thinking about things like that are really important and can make a big impact and show that you are prioritizing mental health and well-being in general. So again, in that same vein, talking about balance, these are some things that we've come up with that are specific to right now when we're very out of balance and trying to maintain. So being, creative on ways that help you alleviate stress. There's lots of free apps and different like free YouTube videos that have mindfulness and guided meditations and that sort of thing. If you're not very good at doing that on your own, I know I'm not very distracted very easily. So a guide always is very helpful. To connect while distancing, to make sure that we're reaching out to those who, might be at risk or are lonely, by themselves, to be reaching out and staying in touch, making sure that that we're not neglecting any of our health. We saw the emergency rooms, especially a couple months ago, their volume just really dropped, which was important. We didn't want all the exposure of everyone, but we know that people were having issues and not coming in to seek that help. So doing it in the appropriate way, using teleservices when you can, utilizing, your primary care doctor when you can, but also checking in with therapists and psychiatrists. A lot of them are doing therapies and things like that. Knowing when to seek help, and just back to the basics, exercise, sleep, diet. It's stuff that we hear over and over, but it's super important, makes a big difference. And being kind and patient with yourselves, that we're going through a global epidemic and a social movement and lots of things all at the same time. And it's a bit much. So we have to take time to make sure we're putting some attention to all those different pieces of our wellness wheel. So in the workplace, we can kind of see the prevalence of mental health and substance use disorder. So 1 in 5 adults will experience a mental illness and by experience mental illness, they mean like where you have to miss work, like consistent, several days of work. It's impacting your workplace because many people will experience a mental illness and still be able to function their jobs and things, but 1 in 5 will have something that will take them, incapacitate them, make them unable to work. Wow. This is a huge, 4 million work days are lost per year. That's a nationwide statistic. It's if someone with mental illness, it averages out to be about 10 days off a year, especially if it's untreated and undiagnosed and things. So it's prevalent. It is impacting your workplace, whether you know it or not. Lots of people are very hesitant to say, I need a mental health day when they're calling off work. They'll often, fib a little, stretch the truth a bit, and tell a little white lie and kind of say, I'm not feeling well, or my child's not feeling well, something. Rarely do we say, I cannot get out of bed today, and that's why I can't come into work. So that kind of covers our, and that 60% of people with a mental illness go untreated. So often folks are, white knuckling and struggling through and trying to get through it on their own and not get treatment. And when we turn that side over to substance use disorder, which often goes hand in hand with mental illness, so can kind of combine these statistics and make them even higher, that employees with an alcohol use disorder miss 35% more days of work than somebody without. That's so often, frequent Mondays being called off, things like that, or taking longer weekends for vendors and that sort of thing. 1 in 10 full-time employees has some sort of addiction. So again, not quite as prevalent as the mental health, but still definitely there. Most companies have around 10 or more employees, I would say. And so we know that we're seeing it. And that a lot of job accidents every year are caused by drug and alcohol use, which is, super unfortunate, not something any employer wants to have accidents, even if they're not necessarily impaired at the moment. If they drank a whole lot last night and this morning are not, up to par and are operating heavy machinery, technically they might not have a blood alcohol level, but they still, the accident was caused because of a substance. These graphics. Oh.
That was me.
Oh, okay. These are just some graphics that I thought were really helpful, specific to COVID. So focusing on things you can control and things you can't control, and reminding people that when they're feeling very frazzled, it's really the things out of your control is how other people are acting. And lots of us get very frustrated, even in traffic, we get frustrated when somebody doesn't follow the rules. That, is just an inherent bothersome feeling to us. So, when somebody's buying excessive amounts of toilet paper or not standing 6 feet apart from you, yes, that can make you uneasy and uncomfortable, but we can't be perfect. We can only do our best. So just trying to focus on the little circle there on, your attitude, having kindness, I think really important is limiting the news and social media, because it's especially intense right now. I'm guilty of it too. I'm all over Twitter most of the time, just trying to figure out what's going on. But those are things I can control, and those are things that I can learn just enough to keep myself educated and safe, and then kind of put it away and not engage any further. And then the other side, the other graphic, I thought was really cool, kind of talks about these different zones. So the growth zone is ideally where we'd like to be. The fear zone is kind of where a lot of us maybe were back in March. So really, grabbing kind of everything. I don't know how long I might be stuck in my house, so I'm going to grab a little bit more than I think I need, feeling, complaining and sharing everything, getting easily upset. That's all reaction of fear. It's not necessarily a bad thing. It's totally normal. That's how we react to a huge shakeup and change in our routine. But then kind of the learning zone is hopefully where a lot of us got in, April, May, starting to give up what you can't control, back over to the other side, identifying your emotions, saying, okay, I know that I'm especially irritable today because, nothing's going right and nothing, you're just struggling to do regular things because it's out of the norm, and identifying, okay, I'm a little bit irritable today. That's all right. I can see it, and because once you can identify it, you can change it. And then that growth zone is hopefully where we're getting now, to where we're thinking about helping others, thinking about where we can be useful, focusing on right now and planning for the future instead of being upset and depressed about what we missed and what we couldn't do, and what big events are coming up that we aren't going to be able to do. Kind of focusing on, well, what can we do safely and within reason, and just looking to kind of adapt and change as we go. So I just thought that those were really helpful in this time, especially, and a good headspace to have if you have an employee that is especially upset or kind of being that complainer and that negative person and fueling the fire. I think this is a good outlook for it. So if we do, there is an amount of uneasiness and anxiety and fear that we're all going to feel, but there's also a threshold once you step over that leads us to, raise a red flag and maybe ask that person some really hard questions, some difficult questions. None of these conversations are easy. It's much easier for me to tell you than it is to actually do it, but it's important. So these are some signs to look at, but they're not always going to be obvious. We hear it lots of times when somebody has taken their own life or has, overdosed and not been able to come back, that, we wish that we didn't see it coming. We wish that they would have said something. So it's not always there, but if you are seeing some of these things, especially the hopelessness, and people giving away things, making plans, talking about, for my funeral, I'd like to have this, and making insurance policy, wills, things like that, take it seriously. And if somebody's saying, talking about, I wouldn't care if I woke up tomorrow. Yes, that's not necessarily a suicidal statement, but that should be taken serious. That's pretty intense. That's definitely some leading into some depression and something that we need to delve into and ask some more questions. A lot of us kind of, yeah, me too, and laugh it off and shake it off because it's awkward and it's a hard conversation, but it's important and can be life-saving. There's also huge events, a life event, a loss of a relationship or death of a loved one, can be really upsetting times for somebody when they need some extra support, and might benefit from a little bit of learning some new coping skills and some new ways of doing things, maybe trying some medication temporarily, or maybe being on some medication permanently to kind of help you get through that and have a more positive outlook. But there's also things like sleeping and eating too much, financial and legal problems, increase of drugs and alcohol. Any of these things on their own warrant a conversation at least, but especially if one or more of these things is put together, especially the access to lethal means, saying, do you have guns at your house? Are there ways that we can maybe lock those up or take those to someone else's house while you're not feeling so well? Again, super difficult, hard conversations to have, but life-saving and super important. So here's how at Columbus Springs we can specifically help, because, okay, now I see my friend, demonstrating these warning signs that you listed. What do I do? So at Columbus Springs, We are open 24 hours a day, 7 days a week. We're open to have anyone to walk in person. We're following all of the guidelines and sanitary procedures, screening everybody that comes in. So everybody inside of our hospital has been screened and is safe, healthy, good to go. We also, to kind of reduce that exposure, are offering telephone and video assessments. All of our assessments determine what level of care is most appropriate for you. So I'll go through the levels of care that we offer at Columbus Springs, and then what other level of care might be. We might recommend that you seek in your community if we aren't the most appropriate for you. So again, we can do that by telephone, or we can also set up a video conference if someone's more comfortable doing it that way. But that way you can reduce your exposure, and you don't have to come into the hospital, have an assessment, and they say, okay, you'll start outpatient virtually tomorrow. And you kind of came up just to leave and come back tomorrow. So those are our options, trying to make it as accessible as possible for everybody to reach out to us. And here's kind of the levels of care I was talking about. So inpatient is the highest level of behavioral health care. We offer that at both of our facilities in Dublin and on the east side of Columbus. There's a little map there for you that shows where we are. These locations for inpatient are adult only, ages 18 and up. But again, they can be accessed 24 hours a day. We do both mental health stabilization, so anyone that's feeling suicidal or is homicidal, unable to care for their ADL, unable to care for themselves, someone that's psychotic, paranoid, that sort of really acute psych. And then we can also do detox and dual diagnosis treatment. So we can detox them, and then, like I was saying earlier, oftentimes a mental health issue is paired with a chemical dependence issue. Normally, if somebody's doing really well, they don't start doing drugs or drinking too much. That's usually a sign that things aren't going so well. So, we'll do the level of care recommendation. If we think that inpatient is the best level of care for you, we'll kind of arrange for that. An inpatient stay is about 7 to 10 days, about a week and a half. But everybody's different. Your treatment team and you will decide kind of how your treatment course is going to go. But our model is set up not to keep you inpatient for 90 days, kind of taking you completely out of that bubble that you were all stressed out in for 90 days and then throwing you back in it has been evidence-based not to be the best to work. So to kind of do this, keeping you safe and having 24-hour nursing observation, meeting with a psychiatrist, we can get you to a stable level. You're not going to be fixed, obviously, in a week, but we can get you to stable in about that week and a half time. There are folks that are with us for a couple weeks. There are folks that are with us for 3 days. So it all depends on that individual. So that, again, like I said, is the highest level of care. And that's kind of what inpatient hospitalization looks like. No matter where you go, if you go to the emergency room and they think you need inpatient, they're going to refer you to a place like ours, with a model like ours. I know level of care is very familiar to me, but I know that for the general public, it's they usually have a notion in their head that either you stay for weeks or months in inpatient, or you kind of just do a one-on-one therapy. But there's a lot more nuances in between those two levels. So once we step down from inpatient level of care, once you don't need that 24-hour nursing observation, we want to get you out of that level of care as soon as we can and as soon as it's safe. So our outpatient right now, a couple months ago, we were entirely virtual. Now we're kind of doing like a hybrid. Some folks are more comfortable coming in and doing groups in person. Some folks like it better. Teleassessment, we actually have had hugely positive results from surveys that we've done over our teletherapy. People are really pleased with it. They really like that they're in their own homes and kind of in their environment, and especially right now can reduce their exposure to others. Don't have to wear a mask if you're on a laptop. So like I said, those in person will still be screened the same way as our inpatient does. And our outpatient, we have 2 different levels of care. We also offer our outpatient services to child and adolescents. So that's ages 5 to 17 that we can serve in outpatient as well. And we do offer transportation for our outpatient services if that's a barrier or challenge to anybody, especially kids whose parents are maybe at work. So partial hospitalization is the higher level of care. It's an all-day programming, 5 days a week. And it's very similar programming to what we have in inpatient, but when you're safe and well enough to go to your own home and sleep in your own bed and come back again tomorrow, it's a really awesome level of care. I really think this is a super especially awesome level of care to avoid going into the hospital. Nobody wants to be in a lockdown facility. Like, that's not ideal. That's awesome for when we need it. But, if we can come to an all-day treatment program and then, come back to our own home at night, I think that many of us are much more comfortable with that. And kids too. I think that that's, if we can avoid inpatient hospitalization at a young age, we definitely want to do that. They can learn a lot more bad habits than good habits sometimes in inpatient. So partial is a really awesome level of care. And partial would be, a step down from outpatient, or you could step straight into it. But you have a couple of weeks of that. Again, it depends on your progress and your treatment team's decision. Your treatment team being you, usually a nurse, your therapist, and the psychiatrist all kind of working together. But then once you completed, we're doing well and thriving in partial hospitalization, we would step you down to our intensive outpatient program, or our IOP. It's 3 hours a day, 3 days a week. So people generally start going back to work. We offer them at different times of the day to hopefully work with your schedule. And that program is 6 to 8 weeks. So it's super, while your inpatient stay, if you're going through all the levels of care, might only be a week. This is several months worth of treatment, and we'll hopefully, we'll build on the skills that you learn at a higher level and kind of teach you how to integrate those into your life and how to, thrive on what you learned in inpatient, because you can't just stay in inpatient a couple of days and be out and be cured. We have both mental health and substance use disorder tracks for our outpatient as well. And like I said, all of our substance use still gets mental health treatment, but they have a little bit more focus on that substance use. So that kind of covers our outpatient. Like I said, we do offer to child and adolescents. We have a really, I didn't include our summer programming flyer, but maybe I'll send that to Sean and have it sent out with the newsletter, because we do have some really cool summer programming for our child and adolescents. We're doing a lot of, we don't have the school portion of the day, so we can do a little bit more fun, like almost camp-like activities to kind of keep the kids for a full day's worth of programming. So we do have, again, Erica, correct me if I'm wrong, but we do have hybrid programming with our child and adolescent as well. Although I will say that people are saying that they'd rather do in person they'd rather their child go in person. But we're happy to accommodate whatever is most appropriate. Like I said, this is just outpatient. If they need inpatient, we can recommend them to an inpatient hospital. But again, if we can avoid inpatient, I think this is a really, really awesome deal. We also super proud of our company. They kind of saw a need and put together these free virtual support groups. So feel free to share this information with your employees, especially those that might be in healthcare. We have some healthcare specific support groups. They are run by clinicians. So you can see some of them are doctors, some of them psychiatrists or psychologists, some RNs, some therapists, so a little bit of everybody. And they kind of just lead and make sure that the conversations are going in the right direction. But they're free. Like I said, they do have a limit, but you just have to register. And then make sure you have the Zoom application, and you're welcome to take advantage of these support groups. I think if you have anybody that's really struggling right now with all the changes, this would be a really awesome option for them. So that kind of wraps it up for me. reminder that mental health care is essential health care. And there's all of my contact information. Please feel free to reach out to me if you need any more information, if you'd like me to come and speak to, kind of get a consultation and see what your company's exact needs are and tailor a presentation specifically to you, your company, or your managers, or however you'd like that to look. But I think that wraps it up.
Thank you, Katie. That was really interesting. Just a question. Mm-hmm. Have you seen the, if you will, the stigma surrounding healthcare change over the last few years? I feel like that's been kind of a topic of conversation. And I just wonder if you're recognizing that there.
Oh yeah, mental health care specifically. Yeah, it's that's why it's difficult, and we're trying to break into these different kind of markets. We can go talk to therapists and psychiatrists and things, but they're already familiar with us. We're trying to break into like employer, because we had HR directors that were coming to us and saying, we have no resources or idea what to tell people when they come to us with these issues. And so just kind of, and talking about is how you break that stigma, making it, normalizing it, making it okay to talk about. It's hard, and there is a level of professionalism you have to keep to it when in the workplace. But that's why we just want to have the resources in those employers' hands so they feel empowered and they feel like they have at least a direction to guide.
Yeah, so somebody knows they have somewhere they could turn if they're ready to make that decision. Yep. I understand from some of our liaisons, like at the police department, the incidence of domestic violence has gone up throughout this crisis. Is that something we can attribute here?
Well, yeah, and a lot of people are stuck at home with people that they don't necessarily want to be stuck at home with, and unfortunately, that does cause sometimes, and drug and alcohol use has increased as well, which leads to more domestic disturbances, and it's tensions are just high. It's everybody's kind of on a little bit shorter of a rope than we usually are.
I think that's true, and I know that we all have people that we typically turn to have answers and to help us get through things, but unfortunately right now we're all in the same position of not really knowing how this is going to look in a week or a month, and so those resources sometimes are just as much at a loss as the rest of us, and I think that makes it a little scary, feeling a little unstable.
Oh yeah, this whole few months has
so, we really appreciate what you guys do there, and I think kind of unsung heroes there at your facility, and I thank you very much for your time. I hope a lot of people maybe quietly, privately watch this, maybe in the privacy of their own home on their own time, and feel comfortable saying, I'm just not getting through this as well as I would hope. Maybe I need to talk to somebody, and you guys are there for that. So thank you very much, Katie and Erica as well. This will be, excuse me, as I said, on our accessible through our website, gcchamber.org, and it will be available on our YouTube page and social media pages as well. So with that, I hope everybody who's listening will continue to watch for our Zoominar series. And again, thank you so much, Katie Radar and Columbus Springs Hospital, for all you do and for being with us this morning. Thank you.
Yes, thank you. Our pleasure.
Absolutely. Have a great and wonderful day, everybody. Bye.
Bye-bye.